Hello and welcome to this tutorial that will explain how to create and use a pre-completed note. For this exercise, we're going to be using the 8-year-old male in room number 9. This individual presents with left ear pain. And before we get started too deep, let's just define what a pre-completed note is. We're talking about the ability to use a note that has been already filled out with the majority of the information that you're going to need. This can be for fast-track cases. It definitely has value for frequent flyers. In fact, you can even name the note using the patient's name at the end of the name of the pathway you used, such as someone who frequently comes to the ER with abdominal pain. It could be called abdominal pain, hyphen, and then the patient's name. There is nothing wrong with that because it will be saved uniquely as a pre-completed note and can be shared out to the team or can be used as your own pre-completed note. Furthermore, the pre-completed note adds to your efficiency by not having to recreate the wheel each time for something such as a fast-track case. Fast-track cases are, even though they're not cookie cutter, in essence they are, however, similar. One can race through those fairly quick using the pre-completed note. Let's go ahead and get started. We're going to get into this 8-year-old's chart, opening up the chart into the PowerNote ED module. The next thing you're going to do is click on Add. You're simply going to run through the process of creating a note and then saving it as a pre-completed. It is a good idea, however, to make sure that a note does not already exist in the pre-completed form. So to check on that, I have clicked on Pre-completed tab. Usually you're hanging out over here, Reason for Visit. Instead, we're going over to Pre-completed and looking to see if there is a pre-completed note that is shared out to the team addressing ear pain. I do not see one here. And if you're one that likes to just look at your own notes, by turning on this filter, it rids the screen of anybody else's notes that have been pre-completed and you're looking only at yours. I see I have one for chest pain, forearm injury, and genitourinary, none for ear pain. Let's go ahead and make one. You go back to the Reason for Visit, click on ear, select the individual reason for visit, which in this case is going to be ear pain. Clicking OK, I could certainly have pulled in my pre-populated information and my note pops up. I'm going to very quickly go through this without a lot of narrative, just to indicate that what I want to do at the moment is simply indicate what is true for this patient. Now down here, the patient has had the ear pain for approximately 2 days. This is going to be one of those variables that will need to be changed from patient to patient. And it is episodic in nature and happens to be the left ear. Described as moderate, and he has had frequent otitis. Perhaps a low-grade fever. And then as I go down the list, I'm just simply going to address everything as I normally would. Into my ROS, I'll indicate negative. He has no cough, he's doing fine respiratory. No lymphadenopathy, skin is fine. All systems are otherwise negative. Going into my past medical history and family and social history, these are the things that certainly are not going to be the same for each patient. So attack these as needed. And I'm through with that. Coming down to my PE, I'm going to indicate now that on his general appearance, he is in mild distress. His skin is within normal limits. His eyes are fine. His ears, now coming down to the PE for the ears, I'm going to indicate that on the right it is within normal limits. Watch what I do now. I need to address the left. I right click on repeat, choose repeat. This sentence is now replicated. I do want to indicate now that on the left, I'm noticing on the left that the TMs are bulging. TM rather is bulging. And there is some erythema and some tenderness. You could certainly be emphatically clear in saying that there really is no discharge. I don't need to make a drawing. So as I complete my note, I'm going to head on down to the nose. He's got no drainage, nose is fine, his mouth is fine, his throat is okay, his neck is okay. I'll indicate the normal limits, and his abdominal is fine. Moving all extremities, he has no problem with that. He's bouncing off the walls, neurologically he's intact. Now coming down to my medical decision making. Differential diagnosis, you go ahead and you fill this out as your best practice dictates. I have no orders for him at this time, so I'm going to go ahead and navigate down to my documentation reviewed. Please remember to do this part here. It satisfies a requirement for HIM. And then finally, I'm going to go ahead and discharge him in stable condition. This little boy is going home, and he's going home at, and I'll take the default time. As you come down to prescriptions, this is, again, up to you what and how much you want to fill out. Simply put in the name of the prescription if you wish, and acknowledge that. On patient education, remember it does take a moment for it to load. Be patient after your first click. Don't keep clicking it. And once it does come to the screen, make sure that all is selected, way over on the far right. And then in the search field, just type in otitis, and we'll go ahead and double click it. It would have shown up down here. Just simply click on it, and there it is. And for follow-up, this individual sees Dr. Paul. I'm going to remove that Dr. Nunn. This is a test patient, so try to work with me here. Once I single click down here and highlight it, that activates this area up here. And I would like to make sure that this kid sees Dr. Paul within 5 to 7 days. You could be more explicit and say 2 days, and you're good to go. And having done that, it now will post to the record. I counsel the patient, I advise the youngster to keep his fingers out of his ears, and I talk to the mom, and now I'm down to my diagnosis, which is going to be otitis media. No need for a diagnosis search. I'm done. I'll go ahead and save my note or sign it at that point. That is the normal workflow. But we're talking about a pre-completed note. Now my next step is, rather than signing it at this point, although that is my intention, I'm going to go up and I'm going to select documentation from the pull-down menu and then click on Save as Pre-Completed Note. I would like to suggest that the team be consistent in their naming conventions. I personally like to put a space and a hyphen and a space and then put my initials. If it has been agreed that this would be a good thing to share out to the team, then you would click on the box. And saving it as a shared pre-completed note then makes it available for everybody. However, that's not my intention. I want to simply keep this one for myself and save as new. I'm now going to sign this. I'm done, and I'm moving on to my next patient. Now, without all the talking that I was doing, we could have done that quite rapidly. Prior to replaying, let's just take a very quick look, and we can now see that the ear pain note has been done. Just my regular PowerNote is done, and I'll get out of the record. I'm back to the tracking board, and let's assume for just a moment that the 18-month-old baby comes in, I guess a toddler at this point, and has an ear problem. Now, I may want to use my pre-completed note. To do that, enter into PowerNote ED in the usual way. Once you get in, you can go to the Add button just like you normally would. And instead of going to the Reason for Visit, come over to the Pre-Completed tab. Once on the Pre-Completed tab, you will see that there is a pre-completed note for My Notes only, and it's ready to use. Double-click it. It launches me into the note. I can take my pre-populated stuff if I want it, And there's my note. Notice that it is essentially done. And as I mentioned earlier, we're not trying to advocate cookie cutter medicine, but what we are trying to do is to lessen the impact of repetitive steps so that you can more quickly process through a note as appropriate. The date and time, this is going to have to be changed, and I'm going to indicate that I saw this individual at 8:30. It's going to retain today's date, and it happens to be that the father is the one that came with the patient today, and this little guy was carried in. We can say that the vital signs would have been completed. The medications and allergies pulled in automatically. They're not pulling in the information from that other child. They're pulling in the information for Albert ZZ test. This is to say that the pre-completed note is smart enough to know that it shouldn't be pulling in this sensitive data from somebody else's record. It's pulling it from the individual record as appropriate. Immunization history, up to date. There are no limitations by history. Now as I come down to the associated symptoms, my constitutional does remain negative, yet this child does not have a fever. So what I can do now is simply clear that result. That was a right click, and I chose clear. And I had clicked on negative earlier. The eyes remain negative. The hearing is within normal limits from what I can determine. There's no drainage. The nose and the mouth and the oral intake are all fine. So there are no changes there. I'm coming down into the gastrointestinal. Neurologic is negative. So there's nothing changing here. Why do I need to redo this every time? And then on the review of systems, I'm going to indicate that this individual kid has a bit of a rash. Okay, so here's where I'm able to make any one-offs if I need to. And if you wanted to embellish on that, certainly just put a real quick comment. You can indicate at base of neck, mom, dad's with him, father states, toddler was rubbing something against his neck causing the rash, and it's just fine, there's no problem with it. All our systems are negative. Coming down to the history, I can indicate any changes here that I need to, otherwise these remain the same. Developmental history, now notice this wasn't here on the 8-year-old. It is now here on the toddler because it is appropriate to put it in there. Now on my PE, I'm going to skip down into the general appearance. He's actually in no acute distress. And everything else is normal here. I come down to my ears, and it happens he has a bilateral otitis media. I'm going to click on the bilateral, indicate that the TMs are bulging. He does have some erythema, and there is pain bilaterally. I'm going to clear this next section. Remember, we did this to fully delineate the changes between the right and the left tympanics. I'm going to clear that. It's going to say, are you sure you want to do that? And the answer is yes. And so now this repeat sentence will not show on your notes, but this one will, where you've addressed the bilateral. I'm done. There's no need to change anything in the nose or the mouth. And everything else remains unchanged here. Lungs are fine. Medical decision making. Once again, change anything that's appropriate. I have no orders on this youngster. And there was nothing else that I needed to look at on the medical decision making. There were no interpretations that had to be done. And at this point, documentation review, it is already filled out. There was no procedure down to impression and plan. My diagnosis is already going to be filled in for me. But up here, patient is going home stable, going home. What time is he going home? At this point, I can go ahead and change that time very quickly. And let's assume that's about 8 o'clock. Having done that, my Bactrim, maybe it's the same prescription. If so, you don't have to change it. If you do, click on it, change it, and you're done. Now on the patient education, you want to make sure that that remains intact. So you're going to come in, click on all, and indicate that this is going to be for otitis. Otitis media, middle ear. I don't want this one. This is a test patient. Try not to look at that. That doesn't belong there. So, but the otitis media down there. and then go to the follow-up. Please remember the follow-up is attached to the same screen. You don't have to get out of it. Just click on the follow-up tab. Larry Starr is the pediatrician. Will indicate 2 days is fine for a follow-up, and click OK. And I'm through with that. Back to my PowerNote. I counseled I didn't counsel the patient. He's only 18 months. So I counseled the family, and the diagnosis at this time is otitis media. I'm done with my note. I'm going to go ahead and sign it. Now, the number of items that we changed on here amounted to about 6. And I would submit that 6 quick changes are a lot faster than filling everything out on the otitis media each time. So remember, we used a pre-completed note to get us to this point, and some other little items of interest here. Anytime you see a vertical bar that colored kind of orange, indicates that this is pre-populated information. In other words, it came from your template that you put together. By clicking on any of these items, a single click brings in the structure, giving you a very quick way to change it. You don't have to keep going back to show structure. So in this case, if it was unknown, Dad has no idea, you can click unknown. So the same thing exists for any other of these paragraphs. For example, on the drainage, it was negative for that first patient where I made my template, but say there is a little bit of drainage. I can click on this and say there's minimal, get rid of my negative, and there's minimal what? Well, there's minimal in the left ear, and it's clear. Okay, so that's how easy that is, and I'm done. That would complete this tutorial on pre-completed notes. It's important to note that now when you go back in and you're about to add a note, if you know you have a pre-completed note, you want to come to the pre-completed tab and look for the one that you put together. In this case, ear pain, MJP. Those are my initials. If you have any questions or want to start doing these pre-completed notes and create them, feel free to give me a call. I'll help you get some started and be more than happy to help you wherever I can. Thank you. And now this part of the tutorial is going to very quickly show you how to do a pre-completed note with minimal narration from me. We'll go ahead and use this individual here. Opening up the chart into PNED, and I'll use the same pre-completed note we did for the ear pain. There, we're done. Now the system is running a little bit slower on account of the fact that I'm recording. I'm estimating roughly 25, 30, possibly 35 seconds worth of delay. What you saw me do is approach it from the very beginning, making sure that my data was accurate. And I see that my date and time had to be changed. Not so much the date, but the time. So I went ahead and clicked into the notes view and simply changed that. The patient did come in ambulatory, and the vital signs came in. In the usual way, I'm going to be simply importing those. So this is a moot point. Just like it would have done here, it brought in the medication and the allergies, keeping in mind that these are unique for this patient. The immunizations were up to date. All of this was acceptable to me. Had I wanted to change anything, all I had to do was simply click into the narrative and change the structure of what I needed to do. So you saw that I did a few mouse clicks here and there and changed the content of this individual's record. Other than that, everything is pretty much the same, because that is the value of a pre-completed note. You're doing this with an essentially healthy individual and simply changing those things that need to be changed. If you have any questions, give me a shout. Meanwhile, thank you for joining us, and I'll be available if you need any help. My extension is 7780.